Hi, my name is Shirley, and I'm chronically ill. And I try to talk about a lot of the revelations and things that I learn on here so that maybe, you know, and that you don't make the same mistakes that I do. Because I'm constantly learning new things, honestly. So I've been talking here recently a little bit about my psoriasis. Now, I had psoriasis a little bit more severe when I was younger. I just had a lot of skin issues when I was younger. I also had things health-wise going on with me as a child that no longer really affect me as an adult. I had different food allergies. And so a lot of the things that I had when I was a kid, I've kind of just brushed it off unless it shows up again, you know, but I had psoriasis as a kid and I've had it a few times since, but it's so rare, so infrequent, and my plaques are so small. I've had it so minor until now. Again, I have plaque psoriasis, which I've always just treated essentially with a steroid cream, or some type of barrier cream. So we're doing all of the things before I get to the doctor that I can. But again, even as an adult, I have a lot of these other skin issues, and a lot of them are associated with autoimmune issues. And so sometimes I try to add them up in my head or just take note of them so I can bring them up to a doctor later. I have a skin condition that's abbreviated to HS. I am not going to try to pronounce it. If you know what it is, poor you, I understand. I've had eczema, I've had a lot of things. And as a kid, I had plaque psoriasis on my feet, and I would also get it around my elbows. And so when I was in the youth home, I would always get flagged for ringworm because they also didn't know what psoriasis was, but it was just psoriasis scales and patches and plaques, I guess is what they're called. They'd pull me aside and be like, you can't touch anything, you gotta go sit over there until we figure out what's going on with you. And it's psoriasis. I have psoriasis. And so I was looking up, I was well, what can kind of kick it off? Is it a stress thing? And yes, it can be a stress thing, but I was what is there anything that's interconnected or interrelated? And I don't know, sometimes I just I don't want to say I play Dr. Google, but I love reading about things that's going on with me. I like to be well informed, and I don't think that we're well informed when we go to the doctor. At least every single time, you know what I mean? I think they try whatever. And this might not be connected, but I wanted to share it for you guys. So there's a connection between psoriasis and beta blockers. And so, hi, my name is Charlie. I also have POTS. I've had it for about the last 7 years, but it's increased ever since I got my first COVID infection, and then more so on the second infection. But there's a connection between psoriasis, other medications as well, but beta blockers, which really stuck out to me specifically. It was propanol. I don't know. It's on here, it's on the screen, and the one that I'm on, metoprolol. Anyway, there's a list of different medications that can kind of trigger things like psoriasis flares in people that A, have never had them, or B, have had them in the past, or they have it currently and it makes it worse. And I'm still trying to dig and what all of this means, because I've also had shingles and things 3 times. I really do just I don't know, I need somebody to really look at everything from a bird's eye view and be this is very odd, because it's odd to me looking at it. But yes, if you are on a beta blocker, especially some of the big popular ones, and you also are prone to psoriasis, being on that beta blocker can exacerbate the symptoms and the psoriasis that you have, or make you, not necessarily make you develop it, but I don't know, awaken it, bring it out in you, and you have active psoriasis plaques as a result of your beta blockers. And so this kind of leads to, questions in your care. And so it's something I'm keeping in the back of my head. It could just be that I'm having a psoriasis flare for the first time in years, but it could be because I've been on my beta blockers for over a year, but they upped my dose within the last 6 months. And I was well, I've been on it for 6 months, but there was specifically things that it can show up months later. So watching it, and you have to kind of decide if the psoriasis is bad enough to pull treatment and try other treatments. I don't know what that would look like, but I'm keeping it in the back of my head and I'm spreading it to you so that you know. Again, I'm not a doctor. I'm just somebody who's chronically ill, who's constantly researching, who's constantly reading medical paperwork, things like that. I genuinely want to understand things. and they're not 100% sure why it does this, but they think it has something to do with lowering some type of autoimmune response, which would lead to the development of the psoriasis plaques. And if you're unfamiliar with like what psoriasis is, so generally speaking, this is what we'd always tell people when I was in aesthetics school. So there's like a cellular turnover rate, and it slows as you age. And so it's usually like takes so many days, and we'd kind of simplify it by saying that so let's say you're 30, it takes a whole month for your your skin cell on your face to like completely regenerate to be like new fresh skin. You're younger and you're a teenager, that's quicker. So if you're like 15, you're maybe regenerating every 15 days. Now if you're 50, maybe you're taking almost 2 months to regenerate the same skin cells that you were doing, within a couple of weeks before. But with like specifically plaque psoriasis, I can't speak for other type of psoriasis because I'm not psoriasi. I don't know the literature, the nomenclature of the plural of psoriasis. There's many different types of psoriasis if you're unaware. But what basically happens is your body has an autoimmune response and starts sending out like skin faster. And so sometimes you'll have just a bunch of skin that's pushed up and it's like 3 days. And so your skin turnover rate in small spots is faster and it builds up like kind of a plaque, if that makes sense. I hope I'm like, I don't know. I feel like I understand it, but sometimes I almost struggle to like explain it to other people, but that's kind of what is going on. And so I'm looking, there's a few different things to do. I keep seeing coal tar soap recommended. I've never tried that. And I'm also seeing some people say lactic acid. Again, I've gone to aesthetic school. I technically have enough hours to be an esthetician in this state times 3 because it's so lax here in Florida. I can't do it. I can't work with my hands. I'm also seeing some people try the lactic acid, which lactic acid is great and it can be really moisturizing and it might help remove a lot of that flakage on top. I'm seeing that that's something that people commonly do. Another thing people do, which is heavily readily available here in Florida, is they use the sun. I don't mean to hearken this name because I know a lot of people feel all kinds of ways and I totally understand. But I know Kim Kardashian has psoriasis as well and has talked very candidly about it, and she uses basically tanning beds. And now we know, okay, that like tanning beds aren't good for you, and I don't want to go, like I wear so much sunscreen. I have sunscreen over my slugging right now because I don't want the sun damage. But I think I'm gonna go out there and I'm gonna cover my face with like a towel and like sit underneath there and just like have my feet out in the sun and see if that helps anything. But UV, solar, things like that, tanning beds can help with psoriasis too. So thinking about trying that. And if that doesn't work, then I'm trying to decide, because it's on my feet, is it awkward? Like, do I go to a podiatrist and be like, do I play stupid and be like, what is this? Or am I like, I have psoriasis on my feet? Or because I feel like sometimes if I say like a specific body part with like a primary care provider, they're like, the hands. Oh, I don't look at hands. I've had physical therapists tell me that. They're like, oh, hands are like, the one told me one time, this is a whole side tangent, but I was like, yeah, I'm like having these issues with my hands. And they're like, hands? Yeah, I don't really work with hands. I don't know how they work. I don't know what they're doing. And I'm like, kind of scared right now to see what we're going to be doing in this physical therapy session. But I get it. It's very intricate, very different. But I just really, really wanted to pass on some things I've learned about psoriasis since this has come back, and some different treatments that I've never tried or have never had available to me before. I've always had like the steroid cream route. I had no idea that psoriasis could be caused or made worse with things like beta blockers. And so that's something you really need to be made aware of, and something that I'm going to monitor. And if it's not going to go away, I'm going to call my cardiologist. It could be just a fluke, but if it stays, I'm going to call him and be like, also, this has happened, and see. But there's like several, I feel like this is why it's so hard to get like healthcare in America, because it's like, who do I go to? And then they're going to tell me to like go to somebody else, or it's going to be at the very least, like the cardiologist isn't going to treat my psoriasis, but if it's caused by my beta blockers, then once that's treated, I also have to go see them, and what's my treatment to look like? And you can develop things that are essentially like treatment resistant psoriasis from things like beta blockers. Like, it's a very serious issue. And so if you have been experiencing psoriasis flares and you're on beta blockers, be aware. Be very aware. Nobody told me a thing, or else I would have thought about it or asked a few more questions. I'm always just sharing my medical screw ups with you guys so you guys don't make the same mistakes I am. Thank you guys for hanging around and learning with me. If you've learned something recently in healthcare, let me know. I'd be curious to learn too.